All right. Hello, everybody. My name is Alicia Hernandez. I'm going to walk you through my ABA project entitled Behavioral Intervention to Promote Table Setting Using the Premack Principle in an Adult Care Setting. This project was completed as part of my SPE 593 course at Arizona State University. I'm going to talk a little bit about the background. So the focus of this project was to increase the functional daily living skills in a client. Pseudonym is Brandy. She's a 35-year-old woman who lives in a licensed community care facility. She is developmentally disabled. And one of the areas that we struggle with in terms of helping her to engage fully in the home community is basically incorporating household tasks that assist the remainder of the clients that are living in the home. So one of the ideas we came up with was helping her to learn to set the table. It's definitely within her repertoire. It's something that promotes independence and helps her engage fully in her environment with the other residents. I chose this obviously because it's socially valid. It is a meaningful task because she's not only helping herself, but she's also helping her peers. And so it can build a sense of autonomy and community at the same time. The question I wanted to answer with this research was, will the use of a first then contingency using a preferred snack increase Brandy's independent table setting behavior? This is the Premack principle, which suggests that access to a preferred activity can reinforce a less preferred one, right? So you put the thing you don't necessarily want to do right before the thing you would like to do. Research by Timberlake and Farmer Dugan has supported this procedure with similar populations. So looking at the poster here, the method that I used here is an ABAB reversal design. And the independent variable is going to be the Premack principle, the first then contingency. So Brandy was told first set the table and then you can pick a snack. The dependent variable is obviously going to be the percentage of tasks that Brandy completed independently in a 5-step table setting routine. Each step was scored using a task analysis and coded based on the level of prompting, ranging from verbal cues all the way up to hand-over-hand support. However, this was generally used for shaping, not necessarily for presenting here in this research. The observations were done daily in the dining area right after lunch, when she's generally calm and responsive. In the baseline phase, she was given a neutral prompt, so no reinforcement. And in the intervention phases, she was given the first then statement, and then she could earn a snack for completing the task within 5 minutes. The results, if you look at the graph on the right, you can see that the pattern is pretty clear. The baseline phase, her performance hovered between 20 and 40%, usually completing just 1 or 2 steps. But once the first then contingency was introduced, her performance jumped to between 60 and even 100%. So that means she was completing 3 to 5 steps independently. When the intervention was withdrawn, her performance obviously dropped again, closing down to even below the original baseline. So then we reintroduced the intervention and her performance again returned to the high levels. In fact, she was at 100% once she realized that there was an incentive for performing the task. So there was definitely a functional relation, in fact, a strong functional relation between the intervention and the target behavior. So overall, the project showed that the Premack principle can be highly effective when we use it to increase independence in life skills, for example, like setting the table. It's a low effort strategy, so it's really easy for staff to implement, and then you can customize it around the client's preferences. And I think it can be adapted to a lot of different daily living tasks. There were a few limitations in this study. Environmental distractions can be one, especially when you're in a care home and there's definitely different variables between visitors coming and other clients potentially having a behavioral episode, which can impact how well your subject is responding to prompts or how well they're able to focus on the task. Also, formal inter-observer agreement wasn't necessarily conducted because of some challenges with second language and just understanding or even being willing. It can be a can do, want to, and know how problem in some facilities, depending on a lot of those different variables. So with those particular staff, it was done most effectively in terms of inter-observer agreement by having the staff together report to the manager, and they can all speak in their native tongue, and they can describe what happened. The manager can ask follow-up questions, and then the manager actually is the one who takes the data on paper from the verbal anecdotal interview. And then future directions. If I were to do this again, I definitely, in terms of a research project, I would incorporate inter-observer agreement with probably a different group home, maybe one that is capable of performing on a higher level and filling out data forms individually. And then, we can compare multiple people's findings versus having all of that done behind closed doors and then the results given directly to me. So I'd like to be a little bit more hands-on in that term. The other things like maybe generalizing this to outdoor meals, like a picnic, right? Can this skill be generalized to other areas or even in a restaurant for pre-vocational skills, for example? Like if I wanted to teach this skill in a way that it wasn't just in the care home, but also this particular client might be eligible to work through vocational rehab for maybe setting tables in a restaurant. So something like that. So I'd also explore other reinforcers, not just a snack, maybe something else that's a more preferred routine in the day. So one thing I may have not mentioned previously, and that is, the difference between a reinforcer and like in terms of tangible reinforcer, right, versus the Premack principle. Is the Premack principle, you're actually utilizing things that are already part of your schedule, or you're introducing things that will continue to be part of your schedule. You're just reorganizing them in a way that you place the non-preferred task right before a more preferred activity. And so it's not necessarily like you're pulling another reinforcer out of your back pocket and handing it to the client, but you're just reorganizing your day in a way that is more efficient and effective for your end result. So thank you for looking at my poster. This was a meaningful experience. I appreciated the opportunity to create a poster. It's something that I've been wanting to do, research and presentations and being a part of a lot of these different events, such as in my state, Cal ABA. So I'm looking forward to the opportunity to do that, hopefully after this master's program is completed. Thank you, everybody.